Okay, good afternoon and welcome everybody to the most recent or May 2015 update to the DOPS Practice Monitor findings with our data through December of 2014. And we really thank you for joining us and also for your active participation in today's WebEx. Okay, so I have a couple slides just describing background to our DOPS Practice Monitor. And actually, but before doing so, the DOPS Practice Monitor is, of course, part of our larger DOPS program of studies. And I'd like to provide some acknowledgments to note that our program would not be possible without the support for independent scientific research from the following organizations: Amgen, Baxter Healthcare, Kiowahaka Kirin, Vifor Fresenius Medical Care, Renal Pharma. And in addition to that, we have country-specific funding as listed on the slide. And importantly, we have notable public funding from public sources in the U.S., as well as 4 other countries as listed. Okay, so the DOPS Practice Monitor, which is our tool to monitor trends in center hemodialysis, was launched at the end of 2010 in anticipation of substantial changes that, of course, occurred originally with the introduction of the updated bundled payment system for dialysis from the CMS, which launched in January 2011. But that wasn't the end of it by any stretch. There have been substantial changes in policy subsequent to then that have influenced care. And we have a schematic or cartoon here showing some of these, including updates to the QIP, updates to practice guidelines, etc. And there's a lot going on in 2015, and I won't spend time on this, as we'll let Mark provide his excellent overview towards the end of the hour. Of course, just to note, the 5-star CMS rating system, the potential for bundle rebasing in the future, the introduction of the ESCOs, the end-stage ESRD seamless care organizations, which are exciting and of great interest. And within the next year, the likely introduction of ESA biosimilars. So these are just some recent or soon to come up changes to policy and or clinical practice that are anticipated. Well, with this in mind, we have the DOPS Practice Monitor. We believe is a very important mechanism an up-to-date mechanism to provide trends in care. And here's just our homepage. And hopefully, all folks on the line have used the DOPS Practice Monitor and gone to our homepage. If you've not, then please do so. We have our web address located on the screen here as well. The DOPS Practice Monitor, just to provide a little bit of information on the methods before moving on to the data, we provide monthly clinical data with updates provided once every 4 months, with a lag of up to 4 months. So again, our update now will provide data through the end of December 2014. We have over 1,500 figures and tables, so very, very detailed information related to patient characteristics and practices. Our sample is a stratified random sample of around 200 U.S. dialysis facilities, and now with over 14,000 patients. This includes data from the 2 largest dialysis organizations, as well as an important contribution of data from the non-LDOs, which is provided through Visanex, which is a provider of electronic health record software for non-LDOs in the States. So, and we thank Visanex as well as the dialysis organizations for their participation in DOPS and the DOPS Practice Monitor. Just to note that we, in addition to providing national estimates, which really will be our focus for today. But also, if you go to the website, you'll see that we have detailed what we call stratum-specific estimates or description of practice. For example, care in the largest versus smaller dialysis organizations, by profit status, by rural versus urban location, by race as well.